see here. Okay, so today we have Dr. Stefancic from Princeton Community Hospital. He works in emergency medicine, and Stephen is also a health officer for the Mercer County Health Department locally. So he has many roles in our community, and he's here to talk with you today about being a doctor in the emergency room and just share a bit of information with us today. Thank you, Stephen, for joining us.
Thank you for having me, Ms. Collins.
We are glad to have you here. So just tell us, Dr. Stefancic, what does a typical day, I know there's no typical day in the ER, but what do you do on a day-to-day basis?
The only thing that is routine on a day-to-day basis, hopefully, is getting up, going to work, and going home. Everything in between that is anybody's guess. There could be days where we see 1 or 2 patients. There could be days where we see 25 patients. Part of emergency medicine that makes it so interesting for me is for one, I get to help the community and get to help people on their worst day. That's what drew me to the field. A typical day for somebody's worst day is not a puzzle piece, is not a pattern, so to speak, which is unfortunate. You never want to have to hold somebody's hand when they're suffering or hurting, but you got to be prepared for that. And that's one of the things I really enjoy about the specialty is you don't know what's going to come through the door, but you're prepared for it. There have been times, quite literally, where I've been making a pot of coffee and they say there's somebody in cardiac arrest coming in 10 minutes. And then you stop everything and you get ready. And there have been times where you have situations like that and you're able, as a team, to help save somebody's life, which is truly wonderful. And then when you hear down the road that they were able to walk out of the hospital, it just warms your heart that you were able to help impact someone like that and use different gifts that you've worked hard and been given to impact others. The day can range from an 8-hour shift to a 12-hour shift, but there's not necessarily a limit of when to go home. So if you have somebody that gets really sick, you're responsible for them and taking care of them. And you are the person that is helping them get stronger. So if they're really sick and they get there right before it's time for you to go home, you have to do the right thing and stay to get them better. And once you get them to a good spot, then you can have another doctor take over. But a typical day is just like you said. It's not typical. We can see anything from a 90-year-old, a 100-year-old, an 80-year-old to somebody ready to give birth. And it can truly vary. And there have been shifts where you take care of all spectrums of patients. Sometimes these patients might go to the operating room. Sometimes these patients just might want the everything will be okay type of conversation. And they'll tell you that. I just want to make sure everything's okay. And then you could have somebody having a stroke or a heart attack. There have been days where we're on the phone with the helicopter saying we need to get them somewhere now. And then we call in a flight. But the true blessing of the specialty is knowing how you can help someone day in and day out, even if it is saying it's okay. It's not a monumental thing sometimes, but it truly makes a difference in someone's life.
So did you always know this is what you wanted to do? When you were in high school, did you have a clue you wanted to be in emergency medicine or just know you wanted to do something in the medical field? What led you to this career path?
Going back just about as far as I can remember, I knew I wanted to be a doctor, even when I was a kid. Before kindergarten, I wanted to be a doctor. I wanted to help people. Initially, I wanted to be a different type of specialist. And part of what I would encourage others to do is to keep an open mind. Although I wanted to be a certain type of doctor, I truly didn't know what that type of doctor did. And I was able to shadow that doctor and very, very shortly into my experience realized this is not for me. Now, I learned that extremely early, either close to the end of high school or early college. So that didn't affect anything. And in order to become a doctor, you have to have at a minimum 7 to 8 years of experience. Generally speaking, there's always little wiggle room in there. And then you choose your specialty. So it's not that you go to school to be an emergency doctor, you go to school to be a family doctor, you go to school to be a surgeon or whoever. You go to school, finish high school, go to college, then you go to medical school, then you become a specialist. So it's a very, very drawn out process, but it's how you were trained well, at least hopefully trained well. So I shadowed and I learned what I liked and I learned what I didn't like. And sometimes it's just as important to learn what you didn't like so you can help gauge what you do like. And that is how I got drawn to emergency medicine. And the more I learned about emergency medicine, the more I loved it. Matter of fact, what drew me to that other type of specialty initially was the emergency medicine aspect of it. I just didn't know it at the time.
Right. And I would say that's good advice for students today too, that, if they're interested in something in the medical field, to do a student internship, to do some job shadowing and see what you like. Because it is a big commitment. You mentioned schooling and background, and I know that that's a huge commitment. Explain to us just a little bit, what is the schooling and background like for, if somebody's interested in the medical field, what do they need to do for as far as college and furthering their education?
If someone is interested, there's multiple steps, but those steps are not always tied directly into college necessarily. So, for example, the medical field, just to be honest, is a very competitive field. When I applied to medical school, there was a very small percentage of people that got in for the number of applicants. So, generally speaking, most people who apply to the medical field or to be a physician to medical school have to participate in other programs to get them extra experience. And there are state programs, there are local programs, or university-based programs that do this. I was involved in a number of those programs as well. It, for one, builds networking, which is extremely important. It builds fellowship, but it also builds your CV, which if is a fancy term for a very long resume, and getting experience with research and understanding all aspects of it. In medical school, there's a lot of moving parts, and you're expected to do a lot of different things. Not only are you learning what medications and what diseases occur, but you're learning what the body does normally. And then you're also doing research, and you're also studying different statistics, and the list goes on and on and on. So in order to show that you're ready for that, you need to make sure you have a good CV. So I'll preface it with that. But to answer your question, you need to finish high school. Highly, highly, highly recommend you do as good as you can in high school. If you can get at or above a 4.0, depending on how the grade scale goes, that's the best. You want to be the brightest gold star in the box of applicants or the bag of applicants or the line of applicants, whatever group of applicants you can be. Then it's important to do well in college. Now, some people will focus on pre-med. Some people will focus on biology. So my major, I have a BS in biology. Some people will focus on psychology or chemistry. At the end of the day, medical schools have a prerequisite list. So that is a group of classes and a group of checkboxes, so to speak, that says you went through the steps to say, hey, you have a good foundation for our program. That tends to correspond with some of what we call the hard sciences, the biology, the chemistry, the physics, those type of things. Just because of all the subclasses, biochemistry, molecular biology, that sort of thing. Once you get through those, there's going to be a certain hour requirement in order to apply to medical school. So in every college class has so many hours. Once you get so many college classes, those hours build up. And then, for example, when I applied, it was 90 credit hours. It is possible to complete those hours before your junior or senior year if you take extra classes and work extra hard. Now, different medical schools have different takes on this type of approach. However, once you get that minimum requirement, you can apply. Then it goes through interviewing. You get the primary application and the secondary application. Once you get through those, they'll call you for an interview if they like what they see. You'll sit with usually more than one person. You'll see what the school looks like, and they'll see how you interview and what your goals and morals are. And one thing I would encourage, just from someone who has done interviewing for other programs, I know it looks it's very anxiety provoking to go into interviews. However, the programs who are interviewing are just as interested in you as you are them usually, because they want to have good applicants. Because by having good applicants and good students makes the school better and makes the community they serve better. So once you go through the interview, if they like you and you like them, then you may get an acceptance letter, and that is up to you to accept or not. You could get a waitlist letter, or you could get a, well, maybe next year kind of letter. But one thing that's not uncommon is people to apply to multiple schools. I chose to apply to a small amount of schools because I knew where I wanted to go, and I really wasn't wanting to go to other places. As time has progressed, the number of applications have increased to medical schools throughout. So once you get into medical school, the first year is how the body should work, essentially in the basics. So a healthy person. There are some other classes in there that talk about how to do physical exams and that sort of thing. But generally speaking, it's how the normal person works without any comorbidities or medical problems. The second year is things that can go wrong. So you got to know how everything should work properly before you can learn how everything can work not properly, or can what we call pathology or medical problems. After the second year, you go into your third year, which is your first clinical year. So these are the basics, what just about every doctor should know how to do. Your family practice, your psychiatry, sometimes emergency medicine is in there, surgery, the whole, is there a doctor in the house type of thing if you're watching a movie. That's where that knowledge comes from. Now, through all of this, there are a lot of tests, there are a lot of certifications that you have to pass, even on the national level, before you can advance. Fourth year is where you can go out and learn the more specialized type fields. For example, you can sit with a radiologist for a month or so and say, hey, teach me how to read a CT scan or X-ray. You can sit with a oncologist if you haven't already and learn about cancer. You can, one of the things I did was I worked with an otolaryngologist, which is an ear, nose, and throat doctor, and learned a lot about the head and neck. I knew in emergency medicine, you see a lot of that. So I wanted to get really good at it. And one of the things I would recommend to anyone going into any field, don't accept the word no when you say you want to do something. Now, that I'll say that with a grain of salt, because that all comes within reason. My backing is this. I applied to medical school early. I did not finish all 4 years of college. I was able to apply during my third year, or towards the beginning of my third year. So that way I could not do a fourth year of college and go to medical school. I had an advisor that told me that was one of the worst ideas he ever heard. I took that. I listened. I filed it away, but I didn't look at it. I walked in a handful of weeks later with my acceptance letter. And he said, congratulations, let's get your schedule set so you can have a good next semester. It's like it never happened.
Mm.
So I recommend, it doesn't matter if you're going into medicine, it doesn't matter if you're going into a science or an arts or a business type background. Everyone has a passion, everyone has a heart. Follow that. There's a little voice in there that says, I want to do this. I think this is right. And if you've had good morals and you've done that, if you've gotten far enough to get to where you are, listen to that voice, and that'll take you places.
I think that's great advice. So just tell us a little bit, what do you think is the most rewarding and both rewarding and challenging about your job? Give us some ups and downs.
So we'll start with the downs first so we can end on a high note. Just by nature of the job, the people are going to have problems at any hour of any day, any time of the year. So you have to be ready for that. That means Christmas. That means New Year's, that means Thanksgiving, that means birthdays. That doesn't mean you're going to work them every year, but somebody has to cover. Heart attacks don't know that it's Christmas time. Matter of fact, it's more commonly referenced that heart attacks can happen on holidays because families can unfortunately be stressful. Another downside is when you meet people on their worst day, sometimes bad outcomes happen, and that is by no fault of your own or others. And having to talk with families and try to explain that. People hurt, and that hurt can be emotional. And sometimes you can't put a band-aid on everything, so to speak. You can't make everybody happy. You can't make someone who is feeling unwell suddenly better when they've been feeling unwell for years and years and years. And as emergency doctors, as emergency physicians, we have an inclination to try to fix it because people come in, there's a problem, we try to fix it. And we can't do that all the time. It's not uncommon for individuals to be upset when we can't do that. And part of the up of the job is learning how to mitigate and form conversation to allow people to be happy and pleased with telling them we don't know what's going on. Because in medicine, that's not uncommon for us to not know what's going on. So, for example, a good communication tool is before anything starts or any tests are done, you set expectations. It's kind of like with school. At the beginning of the year, at the beginning of the class, you set expectations. In college, it's called a syllabus. Um, this is what we're going to do. This is how your grades are going to come. This is how we're going to move forward. In medicine, if somebody comes in and they've had leg pain or foot pain or big toe pain for 10 years, I'm just making this up, and they say, I'm just tired of this. I want it to get better. I want it to heal. You preface it and you say, hey, listen, I understand it's uncomfortable, but if it's been going on for 10 years, it's unlikely that we're going to be able to get this 100% better today. But we can try. Generally speaking, that's what people want to hear. And that's a good thing. And they're willing to work with you. The really good things are when you get to have the encounters that change lives. When somebody may show up without a heartbeat, and then at the end of the day, you're having a conversation with them. When you get to talk to someone who truly cares and they say thank you. Believe it or not, a lot of people that come through the emergency department don't always say thank you. And it's little things like that that make a big difference. But that's where it goes to, you got to know you're doing a good job. People might not see that it's a good job because they don't understand what's going on, because they might still be hurting a little bit. But there's not a medicine that takes pain all the way away. It's a growing type of thing where you try to find a good middle ground, because every medicine has a side effect. And just like every decision in life has a consequence. That consequence may be good, that consequence may be bad. As the person who has the control of giving the medicine, sometimes the patients don't understand that the medicine can be bad. And you have to be able to explain that and do what's right for them, even if they don't sometimes, because I can't give them a medication that could stop their heart because it can make them feel better. And sometimes that's very hard for individuals to come across, especially if they're in pain all the time. So the bad things or the downsides of the job, sorry if I'm rabbit trailing, there's a lot of unhappy people because they're hurting. But the good side is you can take all those unhappy people, generally speaking, and make them happier, or make them more comfortable, and change your life. And sometimes that life changes is a long time. It could be forever if it's a really bad condition. And that's what makes it worth it, is when you know you can really help people, really make them better, and really improve something and connect with them in doing so.
Very nice. Thank you. So give our high school students some advice, whether it's life advice or if they want to become a doctor advice. What advice do you have for our high school students today?
Be happy. Life is too short to be miserable. If it brings you joy to um, to garden, be a farmer. If it brings you joy to work with your hands, whether it be art, whether it be mechanics, it could be an engineering field, it could be a mechanic, diesel engine mechanic or a gasoline engine mechanic, that sort of thing. Do it. If it brings you joy to look at numbers and figure out, oh, okay, we see a trend going this way, then we need to be careful doing X, Y, or Z. Then you could even be a statistician or an epidemiologist. But don't accept someone else telling you that you can't do something. Don't accept someone telling you that that is a bad idea. Now, I would recommend you listen very closely and weigh your options, because guidance is wonderful and that's how you can become successful. But if someone flat out tells you that you can't do your dream or that doing your dream is a bad idea, I would be circumspect to that, and I would be very aware of the surroundings. If you want to be a doctor, be a doctor. Don't be discouraged because you might get a B. Don't be discouraged because you might not get an A. In order to be successful, it's not always the book work. You got to have people skills. You got to understand common sense in clinical scenarios. Just because the textbook says 1, 2, or 3 does not mean the answer is X, Y, or Z. It doesn't always happen that way. Listen to your heart, work hard, and that will be rewarded. It just may take a little bit of time.
I think that's great advice and very informative interview today with Dr. Stefancic. We really appreciate you taking time out of your busy schedule and talking with our high school students. And we also want to thank you for your hard work in our community and all that you're doing, both in the hospital and working with the health department right now. We thank you very much for being with us today.
Thank you, Mrs. Collins.
Thank you.